Hello everyone. Today we are talking about hemophilia A factor 8 deficiency in dogs and horses. I am the presenter Ismail Ayad under the supervision of Dr. Ahmed Thabit. First of all, what is hemophilia A? Hemophilia A is inherited bleeding disorder caused by deficiency of dysfunction of clotting factor 8. X-linked recessive inheritance. Males XY clinically affected, while females XX usually carriers. Rarely affected unless bred with affected male. What are the causes and breeds of hemophilia A in dogs? Genetic mutation F8 gene on the X chromosome. The most commonly affected breeds: number 1, German Shepherd. This is the most common. Number 2, Labrador Retriever. Number 3, Boxer. Number 4, mixed breeds also possible. What is the clinical signs in dogs? Number 1, spontaneous or prolonged bleeding. Examples: epistaxis and gingival bleeding. Number 2, large, deep necrosis, hematomas. Number 3, lameness due to joint bleeding, hemarthrosis. Number 4, prolonged bleeding after surgery or minor injury. Number 5, life-threatening internal bleeding, severe cases. In the severe cases, life-threatening internal bleeding. In the severe cases, it causes internal bleeding, نزيف داخلي. Diagnosis in the dogs. Number 1, coagulation test. A prolonged APTT, activated partial thromboplastin time. الBT prothrombin time normal. Confirmatory test, specific factor 8 assay, low activity. Treatment and management in dogs. In the mild bleeding, rest and local wound care, while in the severe bleeding, fresh frozen plasma, cryoprecipitate preferred if available. Avoid NSAIDs. Examples: carprofen, meloxicam. Use opioids for pain, veterinary guidance. Prevention: genetic testing before breeding. Avoid breeding affected males or carriers, females. Hemophilia A in horses. Inheritance X-linked recessive. Spontaneous mutations occur few predilections. Reported breeds: thoroughbred, standard bred, Carter horse. thoroughbred, standard bred Carter horse. Rare but potentially fatal. Signs and diagnosis in horses. Clinical signs: umbilical muscle or joint bleeding in foals, prolonged postpartum bleeding in mares, spontaneous hematomas or fatal hemorrhage after minor trauma. The diagnosis same as dogs, a prolonged APTT, low factor 8 activity. Exclude other causes, e.g., examples, vitamin K antagonist, rodenticide toxicity. A treatment of affected horses. A fresh plasma or FFP from healthy donor horses, especially for foals. Strict stall rest to prevent trauma. No chimerical equine recombinant factor 8 available. Carrier testing, coagulation studies, or genetic testing if mutation is known. Prognosis. Dogs in dogs guarded to good with prompt bleeding control. Mild cases can live normal lives. Severe cases, while the severe cases risk fatal bleeding. While the horses, poor in severe neonatal cases, mild cases may survive with strict management but should not be bred. The last slide, summary and key takeaways. Hemophilia A is an X-linked inherited bleeding disorder. Dogs, especially German Shepherds, are more commonly affected than horses. Diagnosis relies on a prolonged APTT and low factor 8 assay. Main treatment is plasma, a transfusion for severe bleeding. Genetic testing is essential for prevention and breeding programs. Dogs can live well with proper management. A prognosis in horses is poorer. يعطيكم العافية وأتمنى تكونوا استفدتوا من اللي هو هذه المحاضرة، والسلام عليكم ورحمة الله وبركاته.